Hey everyone, so I got top surgery and today I wanted to make a little video about my experience plus giving some information about the whole process for anyone who is considering or wanting to go through the same process that I did. So I live in Brisbane in Queensland, Australia, and I didn't want to go interstate to get top surgery, so I went with pretty much the only top surgeon I know of who does top surgery, Dr. Alys Saylor. My top surgery date it's a bit of an interesting story. I won't go into it too much, but basically I was supposed to have top surgery done in June, 25th of June, and I did have that surgery done, but, well, kind of. I went into the surgery, but I had an allergic reaction about 15 minutes into the surgery. Well, what the doctors perceived to be an allergic reaction. I went red all over and my blood pressure dropped down really low. The surgeon had already started the procedure. She'd already made one incision plus removed my nipples. So they didn't want to just stop the surgery altogether because, you know, obviously it is a bit of a big deal to have top surgery. So they waited for an hour to see if the redness would go away and if I would, my blood pressure would return to normal, but it didn't. So they had to cancel the surgery, and then I had to go for a process of a few weeks of healing from that first surgery, plus getting allergy testing done to determine what exactly happened. And so I ended up actually getting surgery done completely on the 11th of August. So I am now a bit over 2 weeks post-op. So the procedure that I got done is what is generally known as double incision, where you have two incision lines under your chest plus nipple grafts. I won't go into the ins and outs of exactly how the surgery works because you can find that information online. I might link some information below on the ins and outs of what actually happens in the surgery. But when I first saw Dr. Saylor for my consultation, she recommended that that was the best option for me as opposed to other sorts of surgeries like keyhole or periareolar. So I had my procedure done on the 11th of August at Brisbane Private Hospital. It was originally supposed to be at Pacific Day surgery, but because of my complications, it had to be moved to Brisbane Private. But in general, the top surgery that Alys Saylor does is at Pacific Day. So the first thing that I wanted to know when I was considering top surgery was how much does it all cost? So in total, it is about $11,200 plus, that's just sort of a round figure, for everything. So that figure is made up of $6,700, which is a surgeon's fee, $500, which is the surgeon assistant fee, $2,200, which is the anaesthetist fee, about $1,650 for the hospital fee, and $210 for 2 compression garments that you will wear post-operatively. So you do get a rebate from Medicare for the surgeon fee and the anaesthetist fee. It's not a lot, and I don't know if it varies based on individual on your individual circumstances how much Medicare will refund you, but I can tell you the figures for me and just use them as a rough estimate. So my refund for the surgeon fee was $1,253-ish, and my refund from the anaesthetist fee was about $232, so a bit over $1,400 in total back, which is, you know, like 10% really of the total fee. So I thought I'd talk a little bit about my experience with Dr. Saylor and the other team that I had. So firstly, Dr. Saylor is lovely. She's wonderful. I definitely recommend her to everyone who is considering top surgery in Brisbane or really in Australia at all. I would definitely recommend her. She knows 100% what she's doing. She's very professional, but also very kind and understanding, and she was just absolutely amazing. As well as all the receptionist staff and nurse that work in her rooms that you will be in a lot of contact with post-surgery when they are doing things like taking off the drains, putting on, taking off tape, etc., doing all that sort of thing. So they are all super lovely. They are amazing, and I 100% recommend. So they are at Valley Plastic Surgery is the name of the rooms that Dr. Saylor is at, and everyone there was wonderful. The anaesthetist I had was Dr. Helen O'Toole. I did not see too much of her really, because I saw her a little bit, for a brief consultation before the actual surgery, and I saw, her in sort of the operating theatre for the few minutes before I was put off to sleep, and then I did not see her again after that. But she was also wonderful, very professional. Just, cannot speak highly enough of all these people that I have had the pleasure of, being under the care of. In terms of the Pacific Day surgery staff, where I was for the first procedure, again, all wonderful. You get a really a more sort of personalized care there than in as it is a day surgery and not a hospital. Whereas when I had my actual full procedure done at the Brisbane Private Hospital, I found the staff were not not that they were uncaring, but it was much less personal care. They were seemed less understanding of trans issues and exactly what my surgery was, or what the sort of aftercare would be like and that sort of thing. Whereas Pacific Day surgery staff, because they see it all the time, because that is the go-to place to have for Dr. Saylor's patients to go, they were much more knowledgeable, and I felt a lot more comfortable with them. But the Brisbane private staff were not bad. They just, could not match really how great the staff were at Pacific Day. Finally, I just wanted to touch on the actual bit of the recovery side of it. I may be different for different people, but for me, I had drains in for 5 days afterwards, and you measure the amount that comes into the drains twice a day. They're really annoying, to be honest, just to lug around, but obviously they're important to have. They're not actually as bad as I thought they would be, to have, tubes coming out of you, but they're not exactly fun. You've got bandages. Well, it was a weird sort of bandage. I don't exactly know the technical term for it, but instead of a bandage going all the way around you to hold everything in place, it was kind of like on one side, sort of like a vinyl, but sticky on the other side, so it was kind of like stuck to me. I didn't have that when I went to Pacific Day surgery. They just used regular bandages, so I'm not sure exactly what the normal process is. And you also wear the compression vest, which gets fitted onto you at the hospital. So basically you've got dressings on nipples, on the scars, bandages of some description over that, and then a compression vest over the top. And then after the 5 days are up, you can hopefully get your drains out, which is great. Get all the bandages taken off, because mine was sticky. It hurt really a lot to take them off. You get the first look at your nipples to see how they were healing. You get to see the scars will still have, well, for me anyway, the scars still had tape on them, so I didn't get to see how the scars looked completely on the first 5 days. And then you'll just have follow-up appointments after that. So as for me, my recovery has been pretty good, considering the complications that I had at the beginning. I'll insert some clips of my chest and how it has been looking. But basically I still have sensation, minimal, but still have sensation in both my nipples. Everything is healing well. I'm dressing my nipples twice a day. Well, putting a new dressing on once a day, plus putting cream, special cream on them twice a day, as well as putting a scar cream now that the taper of my scars has been removed, putting that on twice a day. So as for bruising and swelling, I was actually been super lucky. I had minimal bruising, and it's kind of gone, like pretty much going away now. As for swelling, my chest is still a bit swollen, as you can see from the video clips or photos that I will insert, but it has been going down. My chest wasn't massive to begin with, but I'm reliably informed by the nurses and by Dr. Saylor that it will be even flatter than it currently is, which is wild to think about because I already think it's super flat, but you know, not complaining. One of the big things I was concerned about was the pain. And surprisingly, the pain was actually really good. I had so for the first partial surgery, I had actually a lot more pain than I had for the actual completed surgery. I'm not exactly sure why, but I think potentially it's because on the first surgery, I had my nipples removed and then, you know, put back on. But in the second surgery, they didn't need, I mean, they needed to be removed, but they had already been cut and it had healed in that sort of shape. So they didn't, so that pain around the edge of the nipples wasn't really as bad the second time around. I barely felt it, whereas the first time was a lot more painful in my nipples. And you are given painkillers, but I actually didn't need any painkillers the second time around. I didn't need any. I was given two, one that are sort of medium strength, one that are a stronger painkiller. For my partial surgery, I only needed to take the sort of medium strength ones, and then for my actual surgery after that, I only had to take just regular Nurofen for pain, and that was only for the first couple days. So I think also part of the reason why you may be feeling sort of low after surgery is you can't shower or bath or get anything wet for the first 5 days. And I strategically decided to have top surgery in winter because it would be cold, because I thought if I had it in summer and I wouldn't be able to shower for 5 days, I would be so gross and stinky and just feel blah. It's much better to do it in winter when it's cold. I'm not going to be this sweaty and gross. But in saying that, I was still sweaty and gross. My hair was disgusting. My face felt so oily. I was just bleh. Anyway, in the first 5 days, and the shower I had on that 5th day was amazing, and yeah, it was just amazing. So that is definitely something to keep in mind if you're thinking about dates. Is I would say do it in winter because you're not going to be able to shower, and I just couldn't deal with that. Another thing is obviously your movement is going to be restricted quite a bit. So you are basically like a T-Rex that can't move your arms out from your body at all. For me, it was probably like a week or so that doing this stops becoming painful. It's still, I wouldn't do this very much anyway now, even being over 2 weeks, because it does sort of hurt. But yeah, so anything that requires you to move your upper arm away from your body is going to be impossible for first few days at least. Okay, so I think that is it for today's video. I'm planning on doing 2 more videos about top surgery, so they will be coming soon. So yeah, I think that is it for today. I have talked for long enough, and I will see you guys soon in my next top surgery videos. Bye.